In today's Health Alerts, a new study looking at breast cancer found Black women are more likely to die at an earlier age than other ethnic groups. Based on data, researchers suggest that Black women be screened 8 years earlier than the current government guidelines recommend. So here with more is our chief health editor, Dr. Nandi. And Doc, what age is recommended to start mammograms and how much higher is the risk of death for Black women?
Here's the big issue, right? The age recommendations varies quite a bit. And the official recommendations, Brian, from the U.S. Preventative Services Task Force says women between the ages of 50 and 74 should get a mammogram every 2 years. However, the American Cancer Society says women should have the option to start mammogram screenings between the ages of 40 and 44, but to get them yearly between 45 and 54. So it's clear as mud there. Quite confusing. Now, regarding the study, the group of international researchers behind it are suggesting that Black women in particular start mammograms beginning at age 42. And why? Between 2011 and 2020, they analyzed breast cancer deaths from over 415,000 women here in the U.S. And what they found was quite surprising. Here are the numbers for women in their 40s. For Hispanic, Alaska Native, American Indian, and Asian or Pacific Islander women, deaths were 11 per 100,000. For white women, deaths were 15 per 100,000. For Black women, however, deaths were 27 per 100,000, nearly double. They found that they have a 40% higher breast cancer death rate than white women.
All right, so what are the factors behind the increased death rates for Black women?
That's an important question, right? A few things are going on, Brian. First of all, Black women have denser breast tissue. This makes cancer not only harder to detect, but increases the odds of getting breast cancer in the first place. Black women also have a nearly threefold increased risk of what's called triple negative breast cancer. Those types tend to not only grow faster, but are harder to treat. And to make matters worse, Black women are not getting the same care as their peers following diagnosis. There are barriers, apparently, that Black women face, and this includes access to treatments and surgeries. But when it comes to screening, according to data, there are no differences regarding screening rates amongst Black women and white women. But Black women, unfortunately, are more likely to be diagnosed at a younger age. So starting mammograms sooner, as the researchers in the study and the American Cancer Study recommends, should be seriously considered. And it could save lives. In my opinion, there's really no one-size-fits-all when it comes to breast cancer screening. And it's vital that all women, regardless of race, talk to their doctors about family history and then decide when breast cancer screening should begin for them. I've had several family members that have had breast cancer, and so it's really important that we take this seriously.
And that's why we do the studies.
That's right.
All right. Thank you, Doc.
My pleasure.
Appreciate you.